So documentation for an underlying health problem with staff, we've had a lot of people talking about and asking questions about the documentation. When can they get a doctor's note? Could they require a doctor's note for return to work? Should they require one if they know that they've had a complicating factor with they've tested positive, they've been really super sick, maybe they got hospitalized or got, needed more time off than just the normal treatment period, because some of these cases are definitely taking longer to resolve medically. So what do you say about a doctor's note and the use of them in the school system?
So on the front end, I think we have to say we're going to require a doctor's note for people that are in those risk categories. And what I'm getting at there is that FFCRA category 2, which is basically being told to self-quarantine because of an underlying health condition, that COVID poses a risk to you. That could be diabetes, that could be BMI, like we talked about earlier, it could be any number of things. But that specific line says a healthcare provider. So to me, that means we can require a note from a healthcare provider. Does it have to be a doctor? No. I'm telling people that I would take it from a nurse practitioner and a PA as well, but it has to be somebody that says this is why this person, or because of their underlying health reasons and during the pandemic, I'm recommending they stay home for this semester, or 3 weeks or 4, whatever. Got to have that note, though. If you guys just allow them to do it on fear alone, and I don't mean that in a mean way. I get why people are scared. But if you do that, we're not going to have enough people to open school. I'm just really worried about that. We're going to have to hold firm to, if you're wanting to get out under that number 2, you want to use sick leave, we're going to require a note because of those underlying conditions. In terms of returning to work with a note, I probably generally would not do that. Now, obviously, that's different when we talk about workers' compensation and we're not talking about COVID. That gets into a whole other topic. But for returning from being sick, whether that's with COVID or whatever, I would just base that on the guidelines. And the CDC guidelines are clear on COVID that if someone has it, they have to self-quarantine for 14 days. So they cannot return to work during that 14-day time period. After that, the CDC tells us they can. And that's the only way I would look at it.